Clause 15, insert the new clause as printed on the marshalled list.
My Lords, it's a great honour to rise after the noble Baroness Merron, who spoke so clearly about Amendment 52 and the group of amendments connected with health misinformation, some of which stand also in my name. As the noble Baroness quite rightly pointed out, we have known for a very long time the negative impact of social media with all of the death scrolls and the algorithms and the rabbit holes on vaccine uptake. In 2018, Southampton University did a study of pregnant women and found that those who reported using social media to research antenatal vaccinations were 58% less likely to accept the whooping cough vaccine. And since then, things have only got worse. Now, as Junior Health Minister during the pandemic, I saw how the successful vaccine rollout was at severe risk, my Lords, of being undermined by misinformation, amplified by foreign actors and monetised by cynical commercial interests. My Lords, I can tell you that the challenge was enormous. The internet, as we know, my Lords, is a highly curated environment that pushes content, functions and services that create an emotional response and retains our attention. Social media algorithms are absolutely the perfect tool for conspiracy theorists. And a pandemic necessarily raises everyone's concerns. So it was unsurprising that quite a lot of people went down various rabbit holes on health information. My Lords, the trust between our clinical professionals and their patients relies on a shared commitment to evidence-based science. But, my Lords, that can quickly go out of the window if the algorithms are pushing rousing content that deliberately plays into people's worst fears and anxieties, displacing complex and nuanced analysis with simplistic attention-seeking hooks based sometimes on complete nonsense. And the noble Baroness mentioned lemons for cancer as a very vivid example of that. Now, at the beginning of the vaccine programme, there was a very thorough report by King's College London, funded by the NIHR Health Protection Research Unit, and it found that 14% of British adults believed the real purpose of mass vaccination against coronavirus was to track and control the population. Now, it rose to an astonishing 42% for those who got their information from WhatsApp, 39% from YouTubers, 29% for Twitterati, and 28% for Facebookers. Now, I remember when those stats came through, and it was putting this very important way out of the pandemic at jeopardy. My Lords, I would remind the Chamber that there are a great many people making money out of this fear. Can I highly recommend the Oxford University Journal of Communications article on digital profiteering for a really fulsome and nuanced guide to the economics of the health misinformation industry. Can I also remind, noble Lords, that foreign actors, foreign states, are causing severe trouble in this area. I quote, "Foreign disinformation social media campaigns are linked to falling vaccination rates, according to an international time trend analysis published by the BMJ Global Health." Now, as it happens in the pandemic, DHSC, Cabinet Office and a wide group throughout government worked incredibly thoughtfully on a communication strategy that sought to answer people's questions, applied the sunlight of transparency to the vaccine process, and I believe balanced the rights to freedom of expression with protecting our central strategy for emerging from the pandemic, the vaccine rollout. And I'd like to express considerable thanks to those officials and also to the social media industry who lent into the issue, more, my Lords, out of a sense of goodwill than out of any legal obligation. And in fact, I was very aware of some of the legal ambiguities around those times. My Lord, since then, things have gone backwards, not forwards. Hesitancy in the UK has risen with a big impact on vaccine take-up rates. We're behind on 13 out of the 14 what's called routine vaccine programmes, well behind the 95% target set by the World Health Organization. The results are clear. Measles is rising because of vaccine uptake falling, and that is true of many common avoidable diseases. As for the platforms, Twitter's recent decision to suddenly stop enforcing its COVID-19 misinformation policy at the end of last year was a retrograde step and possibly the beginning of a worrying trend that we should all be conscious of and is one of the motivating reasons for bringing this amendment. Unfortunately, the government's decision to remove the provisions on content harmful to adults from the bill, and with it the scope to include harmful health content, has had unintended consequences and left a really big gap. We will have learnt nothing from the pandemic if we don't act to plug that gap in the bill. Amendment 52 and the associated amendments seek to address this by introducing 3 duties, as the Noble Baroness Merrin explained. I'd like to just say a couple of words on those. The first requirement is an assessment of the risks presented by harmful health disinformation and misinformation. My Lords, anyone who has been listening to these debates will recognise that this very much runs with the grain of the bill's approach, and it is consistent with many of the good things that are already in the bill. Risk assessments are a very valuable tool in our approach to misinformation. I remind Noble Lords that for this bill, content has a broad meaning that includes services and functions of a site, and that includes the financial exploitation of that content. Secondly, there is an amendment that would require large platforms to publish a policy setting out their approach to health misinformation. Each policy will have to be explained how it's designed to mitigate and manage risks, and they should be kept up to date and maintained. My Lords, that kind of transparency is at the heart of how we hold platforms to account. And then lastly, platforms will be required to summarise their health misinformation policy in terms that consumers can properly understand. My Lords, this approach is consistent with the spirit of the bill's treatment of many harms. We're seeking transparency, we're creating accountability, we are not mandating protocols. The consequences are clear. Users, health researchers, internet analysts will be able to clearly see how a platform proposes to deal with health misinformation that they may encounter on a particular service and make informed decisions as a result. And the regulator will be able to see clearly what the nature of these risks are. So can I very briefly tackle some of the natural concerns? On the question of protection of freedom of expression, my Lords, my noble friend Lord Moylan quite rightly reminded us the other day, on Tuesday, of Article 19 in the UN's Universal Declaration of Human Rights. Everyone has the freedom to express opinions and speech. On this point, can I make it clear that this amendment does not require platforms to remove health misinformation from their service or to prescribe particular responses? In fact, I would go further. I recognise that it is important to have a full debate about the efficacy, safety and financial wisdom of treatments, cures and vaccines. This amendment does absolutely nothing to close down that debate. It is about clarity. The purpose of these amendments is to prevent providers from ducking the question about how they handle health misinformation, and to that extent helps both those who are worried about health misinformation and those who are worried about being branded as health misinformation know where the platforms are coming from, to ensure that they establish what is happening on their service, what is associated with risks to users, and to shine a light on how they intend to deal with it. My Lords, can I also make it clear that this is not just about videos and articles and tweets. We should also be considering whether back-end payment mechanisms, including payment intermediaries, donation collection services, and storefront support, should be used to monetize health information and enabling bad actors. During the pandemic, the platforms endorsed the principle that no company should be profiting from COVID-19 vaccine misinformation, for instance. It is vital that this is considered as part of the platform's response to health misinformation. In other words, we should have transparency about whether platforms like PayPal and Google are accepting donations, membership, or merchandise payments from known misinformation businesses. Is Amazon, for instance, removing products that are used to disseminate health misinformation? Are crowdfunding websites hosting health misinformation campaigns from bad actors? And so on. To anticipate my noble friend the Minister, he will likely remind us that there are measures already in place in the bill if the content is criminal or likely to be viewed by children, and I welcome those provisions. But, my Lords, as the bill stands, the actual policies on misinformation and the financial exploitation of that content will be a matter for platform discretion with no clarity for users or for the regulator, and it will be out of sight of clear regulatory oversight. My Lords, this is a mistake, just as Twitter has shown, and that's why we need this change. Senior clinicians, including Sir Jeremy Farrar, Professor John Bell and Lord Darzai, have written to the Secretary of State raising their concerns. These are serious players voicing serious concerns. The approach of Amendment 52 is, in my view, the best and most proportionate way to protect those who are most vulnerable to false and misleading information.
My Lords, I rise to speak to Amendments 59, 107 and 264 in this group, all of them in my name, and like the noble Baroness Lady Merron, I wish to express gratitude to Full Fact for their advice and support in preparing them. My noble friend Lord Bethell has just reminded us of the very large degree of discretion that is given to platforms by the legislation in how they respond